One of the critical tests we do for macular degeneration is macular pigment density testing. So we have a certain special type of pigment in the very back of the eye that protects the photoreceptors of our eye. It's made up of zeaxanthine and lutein, and we can test that density. And the importance of that is we know over a certain density that's very protective. It's kind of like having an internal pair of sunglasses that protects our photoreceptors. So if that level's low, it's on a 0 to 1 scale. So at 0.5 and above, we know from studies that there's a long-term protection in place for those folks. So our goal is to get everybody into that safe 0.5 and above area there. So we can do the test and use a product that's guaranteed to get you at that 0.5 level. It's a pretty straightforward kind of thing and a simple test to do. It just takes a few minutes. So that's important to get that level up. And it's based on, yes, supplementation can help us out. And it's also an environmental question in a modern world. We're inundated with blue light. That blue light is what burns that pigment off. So we're in constant competition with what we supplement or what our natural diet gives us in terms of those important pigments. But then we go when we look at blue light. So an example is computer screens, but any device, you might notice that we're a little orange here, and that's for a good reason. I've used a software to squelch the blue light. If I turn that back on, you see your typical computer screen there, where it's pouring out an excessive amount of blue light, which is true for phones, tablets, all kinds of devices, and all of our typical modern lighting. So we can put blue blocking on glasses. We can change our computer screens. We can do a lot of environmental safe things, and then we can supplement as we need to. And the good thing is we only need to get to 0.5. So this is a very achievable thing for anybody.